Hi, I'm Eilidh Fenner. I'm a second year PhD student at Cardiff University, and I wanted to talk to you today about my thesis, which focuses on the genetics of psychiatric disorders. And I wanted to start my talk by asking you a question. What do you think your DNA can teach us about psychiatric disorders? So whilst you think about that, I'm going to talk to you about a psychiatric disorder of particular interest to me, which is schizophrenia. This is a disorder which affects 1% of the population. So that one blue person out of all of these purple people would have a diagnosis of schizophrenia. And it has severe impact on an individual's quality of life. And treatment options are limited. So whilst we can often treat psychotic symptoms of schizophrenia, such as hallucinations and delusions, there are no treatments for the range of behavioural symptoms that come with schizophrenia, for example, alterations to cognition. And there's no one single cause of schizophrenia, but we do know that genetics plays a substantial role in risk for developing the disorder. And many studies use a case control paradigm. So this would mean looking at the differences between the genetics of the one person with a diagnosis compared to the purple people without a diagnosis. However, my work focuses on learning from everyone by looking at associations between an individual's traits and their genetics. And the UK Biobank is the perfect data set for this, as it offers genetic data and data on an individual's traits. And it's not just covering 100 people, it's covering hundreds of thousands of people. So in my PhD, I'm using UK Biobank's exome sequencing data to investigate associations between phenotypes, such as scores on cognitive tests and people's responses to mental health questionnaires, and genetic data in which I have highlighted very rare damaging mutations carried by each individual. And looking for these associations will highlight individual genes and gene sets and biological pathways that are related to these phenotypes, and which are therefore likely to play a role in psychiatric disorders. So to focus back on the question, hopefully you've got a clearer answer now, DNA, along with phenotypes of the general population, such as of the volunteers who participated in the UK Biobank, can teach us a lot about the biology of psychiatric disorders. And the work in my PhD collectively with the work of other researchers within the field can help highlight genes that are involved in psychiatric disorders and therefore highlight potential routes for future treatment options, hopefully in turn improving the quality of life of the people that live with these disorders. So I want to thank you for listening. I'd like to thank Wellcome Trust, my funders, and the UK Biobank for providing datasets that enable research just like mine. And please feel free to ask any questions or get in touch. My email's just on the bottom there. Thank you very much.